Hello everybody, it's your friendly neighborhood pharmacist here, and in this video I'm going to be showing you how to use an insulin pen so that your diabetic self-care journey can be even smoother. If you want these instructions to read though, check out the link in the description. It will carry you to mskcc.org. Those instructions are similar to the ones I present in this video because that is where I base these instructions from, as well as my own knowledge. Alright, so let's get right into it. This is an insulin pen. They can either be disposable or reusable. A disposable insulin pen is an insulin pen you throw away when it's empty or after using it for a certain number of days, while a reusable one has replaceable cartridges of insulin so you can reuse it after the cartridge is finished. It is important to know which one you have. Before we go on though, here are some important things to note when using an insulin pen. You want to make sure you know the exact name of insulin medication you're using. Also, you want to make sure you know your exact dose of insulin to inject each time. Never use a syringe to take insulin out of an insulin pen, especially if the insulin is concentrated. Doing this can result in the wrong dose, which can be very dangerous. Never share an insulin pen with anyone. They're meant to be used by one person and one person only. Sharing insulin pens can cause an infection. For your disposable pens, you should throw them away after a while of using it. So ask your pharmacist how long you can use your pen for, because it varies. Let's talk about how you can store your insulin pens. Too much heat, cold, or sunlight can actually damage the insulin in your pens. So you want to make sure you're keeping your new and unused insulin pens in the refrigerator door. This can keep them from being pushed to the back of the refrigerator where they possibly can freeze. After using your insulin pen for the first time, however, you can keep it at room temperature afterwards. Alright, so now let's get into the actual insulin pen. So there are various types of insulin pens as we run through earlier, but they all have the same basic parts. And looking at this basic model I made, we're going to start with the injection button. Now this is what you press on to give you the injection. Then we're going to look at the dosage selector. This lets you dial to the right insulin dose. Each pen also has a dose window. This shows the number of units of insulin selected. There's also an insulin reservoir. This holds the insulin and holds a cartridge that has the insulin. Also, there's a rubber seal. This is where the pen needle connects to the body of the pen. Finally, you have the pen cap. Now, this protects the insulin when you're not using the pen. This right here is an insulin cartridge. For disposable pens, it's already inside, and you don't have to do this. But for reusable pens, it might not be inside. So here's how you insert it into the pen. So you're going to give the insulin reservoir a twist and pull it from the pen body, and it should come off just like this. Now carefully place the cartridge inside with the port side down. Port being the part where the insulin would leave the cartridge. Now just reattach by doing the opposite of what you did to detach it in the first place. This is an insulin pen needle. Use a new insulin pen needle each time you give yourself an injection. Insulin pen needles normally have four main parts. You have a protective tab. This keeps the needle clean. You'll need to remove this before attaching the needle to the insulin pen. There's also an outer needle cap. Now this covers the needle before and after it's used. There's an inner needle cap as well. This keeps the needle clean before it's used. And then you have the needle itself. This is how the injection is given into the skin. So before we prep the pen for injection, we're going to talk about how you should be choosing your injection site. So insulin should be injected into the fatty tissue just under your skin. Avoid injecting insulin into your muscle. So choose one of the following injection sites. You can use your abdomen or belly except for that 2-inch area around your belly button. If you have a rapid acting insulin, this is actually the best site to use. Another injection site is your upper and outer thigh. If you're injecting long acting insulin, this is the best site to use. There's also the back part of your upper arms and the upper outer part of your buttocks. But if you're going to use your upper arms, make sure you only use this site when someone else is giving you the injection. Because if you try it yourself, you might cause yourself some harm. Also, make sure you keep track of the injection site you use because you want to make sure that you're rotating the site each time. You don't want to keep injecting the same area on your abdomen or else it might get too bruised or calloused. Now we're going to get the insulin pen ready for injection. So first of all, you want to make sure that you're getting the right insulin for the right time. And when you've confirmed that you have the right insulin, then you can go ahead to washing your hands so you can handle the insulin pen itself. So you want to pull the pen cap off the insulin needle and place the pen cap on a table. If you're using a cloudy insulin, then you want to mix it by gently rolling the pen in between your palms. Do not shake the pen. Gently roll it between your palms for about 10 times. You also want to make sure you wipe the rubber seal at the top of the insulin pen with an alcohol swab. And you're going to allow it to air dry. Again, don't shake the pen to dry it and don't blow on it to dry it. Allow it to air dry. So get out one of your needles and we're going to get rid of that protective tab. We can throw that away. Then we're going to twist the pen needle onto the rubber seal of the insulin pen until it stops turning. Make sure you keep the pen needle straight as you twist it on. Then take off the outer needle cap, place that on a table near you. Then pull off the inner needle cap and you can throw that away. Before selecting your actual dose and injecting yourself though, we want to do a safety test. So we're going to prime the pen. This just gets the pen ready for injection and helps you to see if the pen is working properly and get rid of any air bubbles. So you want to look at the dosage window and dial to 2 by turning the dosage selector forward. With the needle pointing up, you want to press the injection button firmly against a table or you can just use your thumb. And you want to look for drops of insulin that come out of the tip of the needle. If no insulin comes out after pressing to 0, you want to dial to 2 units again and then press the injection button again. If you keep repeating that for about 2 times and you still don't see any insulin coming out, remove the needle, put in the sharps container and then try it with another needle. And you want to make sure you're removing the needle by using the outer needle cap by twisting off the needle and then placing that in the sharps container. Alright, so now it's time to give the actual insulin dose. So we want to look at the dosage window and make sure it's at 0. If it's not at 0, turn the dial until it's at 0. Then turn the dosage selector to the dose that you should be getting or the dose that you're going to be giving. When you're giving the insulin, do not inject partial doses or split the dose into 2 injections. Alright, so now we're ready to actually give the insulin dose. You're going to use an alcohol swab, a new one, to swab your skin gently at the injection site that you chose. Hold the pen in your fist with your thumb on the injection button. Now, be careful. Do not push down the injection button before you push the needle into your skin. It's probably best to keep your thumb away from the button before you inject yourself. So gently pinch your skin at the injection site and in one smooth, quick motion, push the whole needle into your skin at a 90-degree angle. 90 degrees meaning straight up and down and perpendicular to your skin. And you want to push gently until you see a small dimple in your skin around the tip of the pen. Now you can put your thumb on the injection button and then press down firmly until the dose window shows 0. Now after the injection, you want to remove the needle, same way as before. You do not want to use the smaller inner cap to put it back onto the needle because that can increase your risk of piercing yourself with the needle trying to put on the smaller inner cap back on. The larger outer cap is what you should be putting on to remove the needle. Now again, you put the needle into your sharps container. If you don't have a sharps container, by the way, check the link in the description to see how you can make one and how you should be disposing of your sharps and needles. After that, you want to put your pen cap back on your insulin pen and store your insulin pen at room temperature, away from too much heat and away from too much cold and not in direct sunlight. Alright everyone, I really hope that was helpful. Don't forget to share this with someone who might benefit from this information. You can also check out other videos on diabetes on this channel. It should be somewhere on the screen where you can tap. Also, please don't forget to leave a like and a subscribe. It really helps out this channel. And if you have any questions, just leave a comment. Alright, have a good day.